Most men think prostate problems are just a natural part of aging, inevitable, untreatable, and only solvable with pills or surgery. But what if that's not true? What if the root cause isn't in your prostate at all, but in muscles you've never been told to train? Here's the shocking reality. Ignoring your pelvic floor might be the reason you're dealing with inflammation, urgency, and interrupted sleep. And while most treatments aim at the gland, science shows the real power lies in restoring muscular function. No scalpels, no side effects, just a few focused minutes a day. This video will show you the daily technique that helps prevent prostate cancer, reduce symptoms of prostatitis, and improve control, all backed by clinical research and decades of physical therapy practice. If you're over 50, this could change how you age. Make sure to subscribe to the channel for more proven strategies on men's health, longevity, and natural recovery. Most men have heard of the pelvic floor, but few actually understand what it is or why it matters. This hidden group of muscles sits like a hammock at the base of your pelvis, supporting vital organs like the bladder, prostate, and rectum. It plays a crucial role in controlling urination, bowel movements, and even sexual function. Yet for generations, male health education has simply skipped over it, as if these muscles were irrelevant or exclusively a female concern. Why do men ignore their pelvic floor? The answer is cultural and medical. Unlike heart health or strength training, pelvic fitness doesn't get airtime in men's magazines or doctor visits. It's an invisible system, out of sight, out of mind. Until something goes wrong, like prostate swelling or urinary leaks, it remains ignored. But this neglect carries a cost, one that often shows up after the age of 50. Adding to the problem is the misconception that pelvic issues are purely glandular or age-related. Doctors tend to focus on medication or surgery, rarely asking about muscle tone or posture. As a result, millions of men are stuck treating symptoms, not root causes. Pelvic floor muscles, when weak or tight, quietly affect blood flow, nerve signaling, and inflammation in the region. Recognizing the pelvic floor as a muscular system, not just a passive structure, is the first step toward better prostate health. And once that connection clicks, it reframes how men approach prevention and recovery. It's not just about pills and checkups anymore. It's about learning to activate and maintain the very muscles that support everything down there. When pelvic floor muscles weaken, they do more than just fail to support the organs. They disrupt circulation. These muscles act as a pump that helps move blood and lymph through the lower pelvis. When they lose tone, venous return slows down, and lymphatic drainage becomes sluggish. The result: waste and inflammatory agents begin to accumulate right around the prostate. This chronic stagnation sets the stage for low-grade inflammation, often without any obvious infection. It's like a traffic jam of fluids, nutrients, and toxins. Without active muscle engagement, the body can't clear the area effectively. Over time, that constant pressure and buildup create the conditions for prostatitis, even in men with no bacterial cause. Many men think inflammation only comes from diet or infection, but muscular inactivity is just as powerful a trigger. Sitting for long hours, poor posture, and shallow breathing all reduce pelvic movement. It's a slow, silent process, one that's easy to overlook until discomfort, urgency, or pain begins to set in. Here's the good news. This type of inflammation responds extremely well to physical therapy and targeted exercises. When circulation improves, the prostate receives more oxygen, fewer toxins, and better immune support. So instead of masking the symptoms, you start removing the underlying tension and fluid buildup that caused them in the first place. Many men assume that any trouble with urination or pelvic discomfort must come from the prostate gland itself. But what if the real culprit is muscular? A tight, imbalanced pelvic floor can mimic all the classic signs of prostate problems: frequent urination, weak flow, and even a feeling of pressure or fullness in the groin. These muscles can squeeze nerves and constrict blood vessels, creating discomfort that feels glandular, but isn't. One subtle clue is incomplete voiding, the sensation that the bladder isn't fully emptying. This can stem from tension in the pelvic muscles, which compress the urethra and limit flow. Another is lower back or tailbone discomfort, often overlooked in prostate evaluations. These aches are signs that the surrounding muscular system is overloaded or misaligned. Here's the kicker: standard medications often don't help in these cases. Alpha blockers, anti-inflammatories, even antibiotics may offer no relief because they are treating the wrong issue. When the root cause is muscular, drugs aimed at the gland itself simply miss the mark. That's why so many men bounce from one prescription to another with little long-term improvement. Understanding this muscular connection can change everything. It shifts the focus from external fixes to internal control. And once men realize that they can retrain these muscles, just like any other in the body, they reclaim power over their own recovery. It's a perspective most never hear, but one that unlocks real, lasting relief. At the core of male pelvic health lie four key muscles that are often ignored, but vital. The pubococcygeus, iliococcygeus, bulbospongiosus, and ischiocavernosus form the foundation of urinary and sexual control. Each of these muscles plays a specific role, from supporting the prostate and bladder to controlling ejaculation and erection. Think of them as the control panel behind functions most men take for granted, until they start to fail. The pubococcygeus and iliococcygeus make up the levator ani group, responsible for lifting and supporting the pelvic organs. When these weaken, everything below starts to sag, including the prostate. Meanwhile, the bulbospongiosus helps with forceful urination and ejaculation, while the ischiocavernosus aids in sustaining erections by trapping blood in the penis. Weakness or tension in any of these can create a domino effect of dysfunction. To visualize this, imagine a hammock holding up several weights. If the fabric thins or loses tension, the weights start to press downward. That's what happens when these muscles lose tone. The organs below become compressed, the nerves irritated, and circulation suffers. Over time, this leads to symptoms that look like prostate disease but originate in muscular failure. What's encouraging is that all four muscles can be reactivated with targeted exercises. Anatomical diagrams show their placement clearly, helping men reconnect with an area they've long ignored. Once men see the map and understand the mechanics, they are no longer at the mercy of vague symptoms. They have a structure to work with and a path to restore what age or inactivity has eroded. Rebuilding pelvic strength starts with proper activation. Level 1 is all about awareness, learning to engage the right muscles without using the glutes or thighs. A simple starting point is lying on your back with knees bent. As you exhale, gently lift the pelvic floor, like trying to stop the flow of urine. Hold for 3 seconds, then release. Repeat this 10 times, twice a day. The key here is control, not force. Once activation becomes natural, level 2 focuses on building strength. This means longer holds, up to 10 seconds, and incorporating resistance through posture. Try the same contraction while seated upright or standing tall. Add slight abdominal engagement to stabilize the core. It's not about intensity, but precision. Doing it right beats doing it hard, especially when it comes to these deep internal muscles. Level 3 introduces endurance. This step trains the pelvic floor to maintain tone over time, essential for bladder control and sexual performance. Practice holding light contractions while walking or during daily tasks. This builds real-world stamina and integrates pelvic stability into your routine. Pair this with diaphragmatic breathing, letting the belly rise as you inhale and gently lift the pelvic floor as you exhale. Posture alignment is also critical. A neutral spine allows the pelvic muscles to activate properly. Avoid slouching, which compresses the pelvic basin and shuts down circulation. Combine good posture with consistent practice, and you'll begin noticing better control, less urgency, and greater awareness of your lower core. It's a daily habit that compounds into lasting results. Most men don't realize their daily habits are silently undermining their pelvic health. One major culprit is prolonged sitting, especially in soft chairs or with poor posture. This compresses the pelvic floor, reduces circulation, and leads to muscular tightness. Over time, That constant pressure weakens the muscles and irritates the surrounding nerves, creating a breeding ground for dysfunction. Another hidden danger is poor lifting technique. Whether at the gym or lifting groceries, straining without engaging the core puts stress on the pelvic base. The result is often subtle, a gradual sense of heaviness or a dull ache in the groin or lower back. Add overtraining into the mix, especially with high-intensity abdominal exercises, and the pelvic floor becomes overloaded without ever being directly trained. Then there's the overlooked habit of holding in urine. Many men do this out of convenience or routine, but it puts unnecessary strain on both the bladder and the pelvic muscles. Over time, this pattern can desensitize the urge to go and stretch the pelvic tissues unnaturally. Tight clothing also plays a role, restricting blood flow and adding external pressure to a system that needs room to function. And let's not forget chronic stress. When the body is in constant fight or flight mode, the pelvic floor tends to tense up, just like the shoulders or jaw. This unconscious bracing becomes a long-term pattern, contributing to pelvic pain, urgency, and sexual difficulties. Identifying and eliminating these habits is just as important as exercising, because no routine can outwork what poor daily behavior undoes. The most powerful changes are often the simplest, when they become part of your daily rhythm. Start your day with a 5-minute pelvic floor routine. Lie down, take deep diaphragmatic breaths, and engage the pelvic muscles with gentle pulses. Combine this with a posture reset. Stand tall, align your spine, and bring awareness to the base of your body. This morning ritual sets the tone for better control throughout the day. In the evening, repeat the process, this time in a seated or standing position. Use the quiet moment before bed to release any tension accumulated during the day. Focus on softening the pelvic floor with each exhale, while maintaining light engagement. This helps balance activation with relaxation, which is key for reducing nighttime urgency and improving sleep quality. Walking is another powerful tool. Aim for 20 to 30 minutes a day, ideally outdoors. Each step gently stimulates the pelvic region, encouraging blood flow and coordination. As you walk, focus on upright posture and rhythmic breathing, letting your belly rise and fall naturally. This turns a basic activity into a subtle, restorative workout for your core and pelvic floor. Consistency matters more than intensity. A few mindful minutes, twice a day, can yield major results over time. The goal is to create a lifestyle, not a separate, burdensome workout. Once it becomes part of your routine, pelvic health stops being a chore and starts being a quiet strength that supports everything else you do. Skeptical minds often want proof, and rightly so. Fortunately, the science behind pelvic floor training for men is strong and growing. Studies by researchers like Nickel and Ponteri have shown clear links between pelvic floor dysfunction and chronic prostatitis symptoms. In trials, men who incorporated pelvic exercises experienced significant reductions in pain, urgency, and frequency, often with better outcomes than medication alone. One key study found that pelvic floor physical therapy improved symptoms in over 70% of men with non-bacterial prostatitis. This is especially relevant for men over 50 who may be dealing with long-standing muscle tension or poor circulation. When these underlying issues are addressed directly, inflammation decreases naturally and normal function begins to return. Beyond the numbers, testimonials from urotherapists and physical medicine specialists reinforce these findings. Patients often report life-changing results, regaining control, improving intimacy, and eliminating the frustration of failed treatments. What stands out is that these changes come not from external interventions, but from consistent, guided self-practice. The evidence is clear. Targeted pelvic floor training is not just theory, it works. And the men who commit to it don't just feel better, they feel empowered. Because when you understand your body and take daily steps to support it, you're no longer guessing, you're investing in results that last. Join our members club to stay ahead with exclusive insights, early access to expert content, and guided routines you won't find anywhere else. Your health deserves precision, and our members get exactly that. Now let's be honest, the majority of men will watch this, nod quietly, and change nothing. But a few will act. They'll do the exercises, fix their posture, and reclaim control over something they were told was out of their hands. You already have the information. The question is, what will you do with it? Your prostate doesn't need more pills. It needs support, movement, and consistency. Start today, and a year from now, you'll thank yourself for this quiet decision. If this video brought you clarity, share it with someone who needs it. Subscribe, hit the bell, and join us on this path of smarter, stronger aging.